Thank you, and actually we just had a mandated reporting hearing down in New York City this past week with the Children and Families Committee, and the Assembly hosted it, and the lived experience there, the lived experience here, I think no matter what solutions we come up with, we know those are the voices that have to be really part of those solutions, right? It can't just be a top-down approach, it really has to be a bottom-up, a grassroots bottom-up from those who have lived experiences if we're gonna change these really ingrained systems. I have three, but the two main things, first I would say on cash assistance, we've studied it. They've started this direct cash transfer for 50 families here through the Health and Human Services, through our CPS. We know Myra Brown's group is running one here. We know the city of Rochester is running. They're all being done in sort of this way where they have to be part of research in order for it not to affect your benefits and like all this other stuff. The data's out there. We know they work. We don't need to do the research anymore. We need to have people who qualify for these programs. So the legislation I sponsor with my good friend Senator Ramos down from Queens is the MILK program, which is really any parent who's income eligible from 0 to 3, they would get $1,000 a month for the first 18 months and $500. We know early childhood that 0 to 3 is critical. If we can get people not to be coming out of that in a hole, a financial hole, in a better place financially, let's just do it. Let's just do it for every single person who qualifies. Second thing is childcare. I'm so glad to hear the lived experience with this past year. It was my bill that we made education certification programs any post high school program. It is now all you need to do to qualify for childcare. You no longer have to work 17 and a half hours a week. So when people make those choices, but childcare is the number one thing. No one should pay more than 7%. We should have a step down. Right now, yesterday, 2 days ago, yesterday, we changed the income threshold to 85% of median income for the state to qualify for subsidies, which is fantastic. But again, the moment you make $1 more, you go right down, and we need to fix that. We need to make sure that that is much more easy. And the last thing I would say is housing. Housing is the bedrock for mental health, substance abuse, for educational outcomes, health disparities. Housing needs to be accessible. No one should pay more than 33% of their income. It has to be affordable, safe, and it has to be reliable. Thank you.
You gotta love Sarah Clark. Ditto. So the question is, if I had mega power, right? So I have total control.
That's what it said.
I would demand a livable wage, guaranteed basic income. So, and we know that works. We experimented with it during COVID, right? The unemployment insurance, the increased amount, $600 a week first, and then it went down to $300 a week. We saw people being able to take care of themselves with that additional income. We need to work toward that. I was joking in the beginning by saying I have total power. We know how difficult that is to get done, but we have to work toward that because we know it works, and it's similar to the pilot programs that Sarah and other was talking about. The other area that I would change is people's attitudes. People don't live in poverty because they don't work hard. People don't live in poverty because they have too many kids. People don't live in poverty because they're not ambitious. People live in poverty because the system is working against them. And I shared my life story. When we talk about systems, we have to realize that my poverty isn't as significant as those who have to deal with it with racial discrimination and systemic racial discrimination. We have to be real about that. And we have to make changes to address that. That change is going to require attitude change, not only from just policymakers, but people in the systems, with our neighbors have to have that change. We have to have those difficult discussions. And I know there's a lot of people in this room who are having those discussions, but we have to kick it up a notch and make it happen. Thank you.